2 years ago today.
Our purpose of this press conference today is to answer our questions about protocols for care and for public safety.
The first COVID case is diagnosed in Kansas. That patient arriving here at the University of Kansas Health System. According to Mark, more than 384,000 cases of COVID were diagnosed in the metro, and more than 4,100 people here lost their lives to the virus. At least 3 COVID peaks so far.
The first thing we're doing is placing the bronchoscope down the existing airway.
Healthcare staff overworked and burnt out as hospitals deal with the first pandemic of its kind in our lifetime. Workers gearing up and taking precautions during their first pandemic.
Hey there.
And all of you wearing masks, social distancing, and staying home.
Were you vaccinated by any chance?
While those at the health system started to show the true side of compassion and medicine.
At the end of the day, I'm not going to let it stop me from partying.
And all of this starting around spring break 2020, leading to one of many super spreader events. And now, as we head into spring 2022, with mask mandates going away, we talk with one travel expert about what you need to know to help keep you and your family safe.
And good morning, everyone. It is Monday, March 7th. Welcome to the Morning Medical Update. Thank you so much for joining us here on Facebook, on YouTube, and now on Twitter. We begin this morning a live look at I-69 highway at Northwest 68th Street in the Northland. You can see the roads there, for the most part, are pretty clear, but there have been crashes reported. You can see one right there on your screen. So please, if you're heading out, if you're heading into an appointment here, leave early today, go slow, not worth it. So be careful out there. 2 years ago, this very day, our COVID count stood at 1. It has been quite a roller coaster of ups and downs. Dr. Hawkinson joins us. He's our medical director of infection prevention and control. Dr. Stites with us as well today here. All of us at the desk, kind of the way it used to be 2 years ago.
This way. Yeah,
Dr. Hawkinson, let's talk about our count as of today, and then let's kind of take a look back.
Yeah, absolutely. So today our numbers are continuing to go down over the weekend. We have seen that right now in the health system. We have 21 active infections, with 4 in the ICU and 2 of those on the ventilator. So overall, the active infections have continued to go down. We do have 57 in that additional criteria meeting that recovery period. But I think the last 2 weeks we've been certainly happy that the active infections have gone down.
So we're going to kind of walk through a timeline here in just a moment, but I have to ask you both. You know, this is the day. On this very day, March 7th, 2 years ago, we received the first patient in Kansas right here at the health system. It's hard to sum up, but how does this rank when it comes to career moments for both of you?
You know, it's an interesting time. Just the pandemic in general, and then even maybe just today, because today is a good day because the numbers are going down nationally. You can see the New York Times heat map, how much better the color in that looks, which is great. I'm old enough to have lived through 2 pandemics, and the HIV pandemic was awful. And I think that we sometimes forget. We had a program here a while back looking back on HIV because 80% of inpatients died. And so but the number of people who got it wasn't like it is with COVID. And there was a lot of political rancor around HIV. It feels worse today, I think, because of the internet and because of social media. It's just exacerbated things.
How do you differentiate between those 2 pandemics, the HIV and now? What were the biggest differences? How did it feel different?
The biggest one is that I think it was easier to avoid HIV because you knew what to do.
Right.
It was pretty clear, and COVID because it's just more ubiquitous. It's just everywhere. Like we say here, it's everywhere you want to be. That's made it a greater challenge to try and control.
I think we talked about that on that HIV show that we did, where it's like, I wish people were as scared of COVID as they were of HIV back then.
Yeah, and in fairness, HIV did have a mortality rate of 80% because there were no therapies for it at that point. And so that is far worse than COVID, right? And so at this point, and when I say it's actually the mortality rate was 100%, it's just on that first hospitalization, it was about 80%, but 100% overall. So that frightened everyone. And I think the challenge for us with COVID has been all the degrees of misinformation out there, Hawkeye.
Yeah.
And I think just a lot of made up facts. And that's been more of a challenge because the internet has become such a hub of information.
What do you remember? It's been 2 years. To kind of give us an idea of, numbers. 1 this day, 2 years ago, and now today, and everything in between.
You know, I remember just a couple months earlier, I guess it was late January, when you had received a text from a reporter asking about a new viral infection, a new respiratory infection in China.
That was the first time you and
Yeah.
I had ever communicated about it. I sent you a text and said, what is this?
Yeah.
There's some virus in China. Are you familiar with it? I didn't know if you even would be. And you said, yeah. And so you came down and we
just
were
watching
answering
it.
questions. But so much has changed.
Yeah, and then it obviously escalated from there quite quickly. And I think, it has been a whirlwind. I do remember that first day. And I had just gotten back into town from a Mayo Clinic infectious disease course. And we talked a little bit about it because it was starting to obviously exacerbate and blow up around the world. So most of that discussion was around infection prevention, though, because we just didn't have a lot of information about the virus itself. But it escalated quickly. I do remember it vividly, and it really hasn't slowed down too much. It has gotten better. Certainly we are seeing now it has improved. I think we knew here at the health system, we had a lot of meetings that first day, and a lot of it was procedural, and we've developed those procedures now, those infection prevention procedures. And those things that we started talking about initially are still the things that can keep us safe. So I think that's important to understand. And while our knowledge we have gained our knowledge about the virus and obviously therapeutics and prevention, it all goes back to those things as well.
And we remember back then it was so difficult to model what the infection was going to look like.
Yeah.
You'll remember that long before we had our first patient, Italy was in the news and was just really hit so hard, and then New York City and Seattle, and you would hear about those things. I mean, frightened was coming this way, and then people would say, well, we're going to have 5,000 ICU patients. We only have 600 ICU beds in Kansas City. How are we going to do that? Are we going to build? I mean, there was so much, we just didn't know what we didn't know.
Yep.
And in the meantime, we were huddled around a phone down here.
I don't know if we
trying
have
to talk
video
to
of that.
audience,
We were
and
talking
so-
about that this morning. If we could pull up some
Yeah.
video with you two.
Yeah, that
We
was
really
just
were getting
great.
so many, and there's Jill, and we were having so
Yeah.
many questions coming in, none of us masked, and everyone sitting very close together.
Yeah,
but
we're right there.
So many
Hawkeye,
questions were
we look,
coming in.
well, you look a lot younger. I still look
Ah.
old, but you looked a lot younger than what
I
happened.
know. It was 2 years of this.
That happened. Yeah,
true.
that's exactly. It's like a
exactly what-
presidency. It's like
Hey,
a presidency.
but I'm putting my stuff on my hands, and I don't
Yeah.
even know what's in that coffee mug because I don't drink coffee, so I don't know what's going on.
It was one of those days.
Clear.
But I want to just remind people if they're just now starting to watch our show in the last year or so, but this went back to when we were getting so many questions every day from media that there was no way to pull both of you off the floors and away from patients and all of our doctors to answer every single question. And it truly was changing. Like every 8 to 12 hours, there was something new coming down every single day. So we were going to do it for a few days, and then we realized we might be doing this for a few years.
Yeah, well, I don't know if we saw it a few years. I thought we
Yeah.
were going to do it a few months.
A year,
we're-
maybe.
Yeah, maybe.
Well, we
yeah,
are entering into our third year as of
had-
today.
We had all those brave ideas that this was going to calm
Right.
down after a few days and that things were going to be all good. And in fact, what happened was that there was this insatiable appetite out there for some kind of knowledge about it.
Mm-hmm.
And early on, we knew that we were trying to build an airplane and we didn't even have a wing yet. And,
Right.
and so it was a little tricky. I remember our very first patient because I saw him as a pulmonary consult on a Saturday morning. I was here because we were working 18 hours a day trying to plan for what we were going to do.
Mm-hmm.
And I was here that morning and I said, God, we don't even know all the dynamics of this. I'll go in because I don't want to send the younger pulmonary guys because they're, I was already here and I'm an old guy. So I was like, okay, I'll go in. And we had the space suits that we wore.
Yeah.
And, they're really our hazmat suits. And we didn't know what to do. So we went in and I just remember we'd only heard about Italy. We'd heard a lot about New York, and this woman had been at a medical conference in Boston, which is one of probably the first super spreader event in the United States.
Mm-hmm.
And that thing had gone through, and those people had all gotten on planes, and they'd gone all over the country. They'd all been eating lunch or dinner together, and they were all packed in around a table, and it was a microbiology conference. Right? And so then these people all these medical epidemiologists, they become these super spreaders. And I just remember the look in her eyes and how afraid she was because we just didn't know what we didn't know. And we didn't have any therapy. And, and so those were tough days.
Mm-hmm. All right, I want to get to this timeline that Dr. Hawkinson is going to, he's our timeline guy. Make sure you get your questions sent in to us. You can get those in by going to Medical News Network. You can go to Twitter, Facebook. You know how to find us. Send in your questions, and we'll get to those in a bit. Do we have any reporters on the line? All right, we are clear for today. We're going to get to some community questions, talk about our 2-year anniversary, if you will. So are we calling it an anniversary? We've got a great travel agent guest who's going to talk about spring break, which is kind of what everyone remembers. Remember the basketball tournaments getting canceled. Remember spring break being put on hold. So we're going to talk about that. But a lot has happened since those 2 years. So Dr. Hawkinson, just kind of take us on another trip down memory lane.
Yeah, so we can see how things have progressed. You know, Jess, as we said, it was March 7th, 2020, and we got our first COVID patient here at the health system. Then about a month later, we experienced our first surge from spring break. There were 41 new COVID cases reported. And that was just the start, however. We would treat hundreds cases, more cases before the next sure hit, which was then Thanksgiving of 2020 with 114 cases. And it was around that time that the first COVID vaccination began to be distributed. We began to see the numbers significantly decline as people wore masks and got their shots. And then in May 2021, the surge returned. 76 new cases were reported. While we were still dealing with COVID cases, we wouldn't see another surge until the start of the new year in 2022 with Omicron. And then on January 24, 2022, we had 154 new cases of COVID reported here at the health system. It would hold that way for some time, but it wasn't until a few weeks later that the numbers would finally begin to drop off, and kind of that's where we are presently.
So quite the roller coaster.
Yeah.
And you said four surges, really.
Well, because the first one was a surge, we just didn't get hit as hard, and it took a little while for it to get there. And so it was kind of like we had the original strain, then the Alpha strain, then the Delta strain, and then the Omicron strain. I mean, and the story is each time we got a new strain, we got hit again. And I think that's really probably our challenge. And the other thing we ought to look at is that the two worst surges we've had have been in that late fall, early winter time frame. And it begins to give you a feel that maybe there's going to be a little seasonality to this.
Yeah, you know, and we have said throughout this, you know, because we saw it in the warm months, in the summer months, that there were still cases going on.
Still, yeah.
Now, with any luck, there may be some sort of seasonality to that, but I think it still remains to be seen because we know it does spread so easily. But I think you're exactly right, Steve.
So one of the first memories, like as we mentioned, was back in March when people were happy to cancel their travel plans, and so we want to bring in a vice president of Ascendus Travel, Kathy Sudeikis. Good morning, Kathy. How are you?
Good morning. Nice to be with you.
Hey, nice to be with you.
I remember that mass very, very well.
Well, that's what I wanted to ask you is kind of what were your, I mean, this directly impacted the work you do every single day and all of your clients. What are some of those first memories that you have? Take us back down memory lane for you 2 years ago.
Well, it started so slowly, of course, but what happened was as one of the doctors has suggested, Italy was the first to sort of fall in the dominoes. And I happened to be working with St. Thomas Aquinas and St. James Academy with spring break senior pilgrimage trips, leaving on Friday and on Saturday, 70 kids. So by Monday, I had to meet with the parents and share with them that if we canceled the plans, instead of the airline or the government closing Italy or anything like that we wouldn't get a dime back. But if we could just wait, literally by the hour, by the evening news, find out what airlines were canceling space, what cities were closing up, because by Tuesday, Rome and southern Italy was closed as well. And then by Wednesday, they had stopped, United Airlines had stopped flying into Italy. And yeah, it was a nightmare for all of us. We were able to finally convince the airlines that our students could not use a $2,000 credit voucher in 2022 when they left for freshman year of college. But it was under duress for sure. We were all a wreck in every part of our business, in the corporate side, getting people home, and on the vacation side, just going to plan B with everyone.
Well, and Kathy, it takes a lot for people to cancel their travel plans. I mean, when people are canceling plans and there's something going on, and the airlines are just something I think we all think are just going to always be there. It's like it's like a hospital. It's always open. Travel never stops. So when things stop and go to a halt, and it affects our travel and trying to get to where we need to go, it really is an eye opener. Talk about the COVID restrictions, where they've gone and now where they are, and how that's going to help travelers as we head into the spring and making our summer plans.
Well, let me say first off that the airlines are still requiring masks, and you're a lot better off, as I'm sure the physicians have said, that they have an N95 or a KN95. They help you breathe a little bit better than the cloth masks, and that has not changed from the minute you walk through the sliding glass doors at the airport. You are to be masked and until you get out at the other end of your trip. And they're not fooling around. You've heard the stories about people who tried to give them guff and give them discussion about not being able to wear it for medical needs and that kind of thing, and the altercations that have taken place. I took my mask down literally to take a breath, and as I walked up to the ticket counter, and you would have thought I had committed hara-kiri. I mean, they just barked at me faster than the speed of light. So I know how serious they are. And then, of course, on the plane, you can take the mask off if you're drinking, and they only are serving soft drinks and water. But, you know, you're feeling good about being on an airplane anymore. People have the masks, the people next to them have masks. But I still would take the handy wipes, the sanitizers, to wipe down the armrests, to wipe down the table in front of you, and the little bit of the hand sanitizer too. You can't go wrong with that one in any destination you are. And use it on the TV channel changer in the doors of your hotel room and in the facilities in your hotel room.
Kathy,
I mean, all of those caveats are still very important.
You don't have to tell me twice. I'm a germaphobe. I've been wiping down that remote control for years, and I'm that mom. I've traveled with kids. Like, don't touch anything. Don't touch the windows. I wipe everything down. So I was ready for that. Masks took something to get used to, but I think we're getting there too. And I know Dr. Hawkinson, you did a lot of traveling, very safe traveling during the pandemic. You were kind of our in-house travel advisor because you were the one kind of telling us what it was like on the planes, and you said you'd get on planes and sometimes not even eat just because it was safer, right?
Yeah, absolutely. I think we go back to those early infection prevention measures that Dr. Stites and I talked about, and we knew what kept us safe. And certainly when you are in a crowd of other people, the masking is helpful. And I still wear, to the chagrin of my kids, I still wear the visors, the eye protection on the plane.
A teenager loves it when their parent wears a visor on an airplane. You know they do.
I still wear, the eye protection, the mask. I think it helped. It kept us safe. We also know that there are those air currents and those airflows in the plane itself. But when you do go into that, whether it's an airport or a train station or a bus station, you're just going to be around other people. So continuing to do that, wear masking continues to be very important, I feel.
It'll be interesting to see what happens with FAA and the CDC, because the current mask guidelines for airlines and mass travel are set to expire March 18th. And so we'll find out if they get renewed or not. Yeah. And I wonder how that will go. I think we've demonstrated that airports with masks and airlines with masks can be incredibly safe. And I know I think I'm going to keep wearing my mask on an airline.
Me too.
Because I used to always get sick after I traveled. And I'm like, you know what? It's the airline.
Well, how many times did you get sick and you go, I must have gotten it on the plane?
I got it on the plane. Even though I think the airflow dynamics on planes have improved remarkably through the pandemic, I think that's been a really a strong thing. But I think that as you look down the road, you have to wonder, what are we going to do on March 18th? Are we going to keep the mandates intact or on mass travel, or are we going to relax them? I'll be very curious to see what the CDC says.
But it's like what you both have always said. You got to kind of assess your own risk.
You do.
Just like you're walking into a restaurant.
I'm still 62 years old. I didn't get younger through the pandemic, unlike Hawkeye. And I will probably still put that mask on the plane.
Yeah.
All right, so we're talking about... Go ahead,
I would
Kathy.
love to know if putting on the air vent is plus or a minus, because I heard that dissipates the germ, but also I've heard that that's where it's coming from sometimes.
Well, we just had a community question come through, so we'll go ahead and get to some of those anyway. But somebody asking about that recycled air, like how healthy is that? But you said the planes have gotten better.
Well, they use a lot of filtrations on there,
yeah.
So that what happens when you filter air, you tend to both do some electrostatic thing to take some charged particles and accumulates the particles, and the viruses can be considered like that. And then it's got some microfiltration to try and eliminate viruses, etc. And then they try to bring a lot of air in from the outside. So if you look at how planes are done, I actually think, Hawkeye, I think it's pretty safe.
Yeah.
I think they've done a great job on that. But the problem is you're still sitting right next to somebody.
But you don't know.
And you don't, and all you have to do is cough, and they're still going to create a breath cloud you're right next to.
And I would say, just again, opinion, I think using the air jet that comes down for a little bit of air, and I think that's pretty good. I mean, it's obviously going in one direction, so it's coming from top to bottom. It's going to still be dissipating any particles that may be in the air, all for the concept of making it less concentrated if you are inhaling droplets, or those droplets are coming and being filtered by your mask. So I think it's a fine thing to do.
We need to bring one of these airlines. There's some experts who who talk about this, because I believe airflow goes from the top down to the floor of the cabin, and so that way when you breathe, the things are sucked down, and the jet kind of pushes the air down there. So I think the jet probably helps break up the breath cloud a little. But we ought to bring in one of our Ahmed folks who actually they know a lot about, probably a lot more than we do, about airlines and the way the airflow has been constructed on the jets. And so let's work on that.
Okay, we'll work on that. Okay. There's a reason, though, why after I travel on an airplane, I go home and take a big shower.
You are a germaphobe.
I just want it to go away. I don't want to smell like an airplane. I don't want anything on me. Okay, so we're talking with the Vice President of Ascendus Travel, Kathy Sudeikis. Kathy, so we're going to take a look at some popular tourist areas, including Mexico, the Caribbean. I think we got some video of that this morning, even out in Hawaii. Oh, that looks so nice. Who doesn't want to be there right now? So tell us, since the pandemic started, somebody was asking this question the other day, like what trends are you seeing? Has travel trends changed over the last, are people RVing? Are they staying at Airbnbs? What trends are you seeing with your clients?
Well, there have been trends, so I'm glad to share some of that with you. People talked about going on RVs, and some people did. But then you found out that RV travel was not as easy as you thought, because you need to find places to park it every night, and you need to find water sources and those kinds of things. So while people have suggested that they would do that, it's been a little tougher to pull off than they thought. But there are ways to make that happen. There's also been away from Airbnbs, surprisingly enough, not knowing what things would be. Airbnb travel and staying away from a hotel has been a trend for a number of years now, and I think that slowed it down just a little. But I have to say, people want to travel, and travel is back. I mean, completely. And not only are people wanting to go and planning to travel this spring break and planning to travel this summer, they're taking their whole family, not leaving anybody behind. And they're splurging more than they would. They're wanting those beachfront rooms instead of wanting the mountain view to save some money. It's an interesting dynamic about setting us free, and people just having such pent-up energy about that.
Well, and I know with both of you, like your moments to be able to leave here and go travel have been like your space to just kind of unload. And travel's been something people have really relied on to take a break from this pandemic.
So can I tell a quick story?
Yeah,
about that?
I love a good quick
All right,
story.
here we go. So I used to always go camping deep in the Ozark Woods because I was never around anybody really in the pandemic. This last weekend, I was down fly fishing on the White River in Arkansas, and just a quick trip, and it was so crowded. And I said to the guys, like, "Is it what's been going on?" I said, "I used to be down. Wasn't this?" He goes, "Ever since the pandemic started, this has been a place people could go and they could be outside. And the fly fishing industry has done very well. The White River had lots of boats on it, and the fishing was only okay, but there was a lot of fishing pressure." And I was like, "Holy cow, this is so different than what I remembered." There's some used to be parts of the White River you go, you just wouldn't see a lot of people, but a lot of folks outside, a lot of people getting outdoors, and I think that's probably been a good thing.
Yeah.
But some industries, I think, have benefited from it. I know the fly fishing industry has been very happy.
You just try to escape from us. Are you traveling again soon? Are you having a vacation anytime soon?
I haven't. I'm not.
You're stuck here with us for a while?
No, I make no. I'm not revealing all my stories. So
Oh,
there you
okay,
go.
okay.
Yeah.
We know.
I am going to spend a little time with my daughter soon.
Okay, good. So, Kathy, what has been kind of the take from just your clients? when this all happened, what were those conversations like with you over the phone when you were having to explain to them just maybe that things were going to be a little bit different? Were you having to help them through safety precautions and explaining to them about the masking on the airplanes and in airports? Just were your conversations different when you were booking travel?
Absolutely. The question was, can I travel? And so for a long time there was just travel stopped completely. And from our neck of the woods, of course, spring break and Easter travel were right in the midst of that. And so everything was having to cancel. And the question was, do you cancel and lose your money on your terms? Do you cancel on the airline's term or the destination's terms? And then you may get a travel credit, or do you get your money back? So that whole worry-free element of travel has been kind of the thing that people are talking about now, so that we keep money in the till and moving through the hotels and the airlines and the cruise companies. Everyone has been very generous about offering these worry-free opportunities where you can cancel to the last minute. You can have your choice of either getting a credit back and maybe getting some additional 25%, even as much as that credit additional to the money you've already had under deposit or paid in full, or you can pay a little bit higher on the front end and get your cash back with no problem. But one thing that's really important, there was so much advice about cancel for any reason insurance. And Americans really do care more about losing their investment rather than they do about their health and their body and those kinds of things, even their luggage. But they really are worried about the big investment that they've made, and that has deterred a lot of travel. But the cancel for any reason insurance came to the table. And while it sounds perfect, there are a lot of caveats with that. For example, the price is double what the normal insurance is, and the payout is only 50 to 75%. Each policy is different of the total amount you've paid. So it's a slippery road. Traveling today with the requirements to get in and out of countries and back into the United States is still complicated, and you wouldn't want to try and do this online on your own. Just too many open-ended questions, and we are being bombarded in the travel community with offers from hotels that still have opportunities, plus all of the kind of requirements up, requirements down, masks up, masks down, that the hotels in the Caribbean, for example, really did a fabulous job, because what they did was on check-in with the proper paperwork, you were able to check into the hotel, and they immediately booked you for a testing opportunity the day before you were leaving. So if you arrived on Saturday, the following Friday, you go to one of the ballrooms that they'd turned into an infirmary. They'd give you a quick test. You would, by noon or 1 o'clock, have your results and go back to the airport the next morning, and everything was fine. You boarded your plane and headed home. So, and they test every person that comes into the hotel space, whether they're delivering volleyballs or whether they're delivering booze or food or anything. Every single guest in the hotel, sorry, not the guests, the employees or visitors or delivery men were being tested.
Okay, on this snowy morning, I think we're going to take a live look at St. John. Who doesn't want to be right there right now? Thank you very much. Well, I think you made a good point, though, Kathy. Just worry-free booking, because for me, I'm one of those people, I don't get to travel that much. So part of it is just the fun for me is to book something and then have something to look forward to. We booked a trip 2 years ago for Christmas to surprise my mom, to take her to New York City, and then it hit, so we had to cancel it. So now we've got up until September 7th, I think, to use our ticket. So me and my sister are trying to rebook that travel again. But I think you're right. People want to book and feel like they have some sort of options. But yeah, you have to kind of book with caution, no doubt. Kathy, just a quick message just to folks. What would be if you had one piece of advice right now as people are booking for spring break and certainly heading into the summer, what would be your one big piece of advice?
Well, don't try and do it alone. There are way too many variables. If things would go back into a lockdown situation or a temporary lockdown, nobody wants to think about that option at all. So you have to be protecting yourself and be prepared to protect yourself. But I would say the biggest piece of advice I would give people right now is be at any airport or any destination early and to pack patience. It's nothing is quite as smooth as it used to be. And if you go with the flow and you use this as a time to relax and really unwind, you can enjoy every bit of your trip. I've just come back from the Middle East. I was in Dubai with a number of girlfriends, and we had to be tested 3 times, but we were fine. I mean, the hotel sent a nurse up to our rooms and tested us, and we were fastly able to go ahead and do our things.
Sure. Well, it's the price you pay for being able to travel the world and enjoy your life and stay safe. What about the with everything that's going on in the Ukraine? Is that stopping people from traveling? Has that caused any issues as people book overseas?
In solidarity with the people of Ukraine, almost every cruise line has stopped their calls in the Baltic that go to St. Petersburg and places like that. There are also Black Sea cruises, but those are fewer and farther between. But any tours that were stopping, first of all, cruises, they were able to unilaterally either eliminate them entirely or change the itinerary and put something else in its place for St. Petersburg. People are starting to ask possibly about Central Europe and Western Europe when they travel. But again, this urge to travel and understanding that things are further away than you think. If you're in Paris or if you're in London, you're still a distance from where the fighting would be.
Okay, we're going to take a few questions from our viewers right now. I'm just trying to find the one that I like, Dr. Stites. Okay, Jan wants to know, is there any way to help restore loss of taste or smell to recovered COVID patients? Are we hearing, that was a big question back in the day.
I think this thing is still the A, time, and B, retraining, because it turns out that part of the issue is not necessarily that you don't taste, but that what your brain thinks is taste has changed, and it's like you have to relearn it. And so there are some therapies, I think our ENT people have been on before talking about Hawkeye, the relearning and retraining of our brains and taste, and I think that's probably still the mainstay of therapy along with time.
Yeah, I think you're exactly right, Steve. It is that time factor. We know that a large proportion of the people's taste and smell come back by 6 months, but we also know that there is that group and that percentage that doesn't, and it just takes time. And if you remember correctly, the virus doesn't really infect those nerve cells that help with smell and taste. They infect and they destroy or cause damage to those support cells around it. And so that is probably the mechanism of why you're losing that smell and taste. But I think to your point, Steve, it really just is time as those cells start to regenerate and come back to normal functioning.
Greta, I hear your question, and I'm one step ahead of you. I'm going to ask the doctors it in just a moment. Okay, question from Lesko. Looking back over the last 2 years, I'm sure you both get this question a lot. What do you wish you would have known back then? Was there anything you wish, if you had the crystal ball back then, and it could have helped you see into the future? Resources about treatment, anything that stands out?
Well, we should know the right answers to therapy. And so we knew all the parts about, because we spent a lot of time focusing on things that turned out weren't as important, and one of them, surfaces aren't as important as air. I wish we would have done a better job explaining the importance of masking, because I think we could have ended up not watching nearly as many people die. And even today I sometimes struggle with just trying to explain the importance of trying to take care of each other when we have these severe outbreaks. Hawkeye, I think to me, I thought we worked hard at it. I wish we had done even better. I think we got better as we found our voice, et cetera. But I think that the importance of masking is perhaps something that we may have even lost a little sight of today.
Yeah, I think that's right. I would agree with you too. That became one of the earliest issues, non-medical discussions and anger was about masking. Because number one, we didn't have the data about SARS-CoV-2 specifically. We knew there was some other data about other viruses, but just jumbled into the mix were the studies and things like that. So I think masking is right. I would say early on it was PPE. We were really struggling with PPE here at the health system, and now we of course have supply, but back then we didn't have a lot of supply on hand, and even our suppliers weren't able to get those things. And so I think that was important very early on in the pandemic when we were trying to really ration PPE. And we should continue to ration, importantly, and as we should, but we have much more supply now, and so I think that's been good.
You know, what I would also say is that if you remember on the original series of Star Trek, Dr. McCoy would figure out the infection, get his antidote done, and have those special syringes that went into the neck with a lot of hiss of air, and everybody was fine within 1 hour episodes. I wish we could have had that kind of timeline for SARS-CoV-2.
It had to be nanobots.
That would have been awesome.
Yep.
You know, live long and prosper.
It all leads back to Star Trek. Okay,
It
Kathy.
always does.
Isaac has a question. Have travelers' questions regarding COVID helped revive the travel agent industry? And I will have to say, I do not travel unless it is through a travel agent. I do not trust myself going online and clicking around and hoping that the minimum dollars that I have to spend to travel, I want to make sure that they're put to the very best use. So I always use a travel agent. But do you, he was just feeling like that people don't use travel agents as much anymore due to resources on the internet. Has COVID really kind of revived that?
Well, certainly it has. Travel agents have transitioned from being agents of the airlines and agents of the cruise companies, for example, into being advisors. And we're a tool in your toolbox, just like a cardiologist would be a tool in your toolbox, or someone who handles your allergies. So when you have travel plans and you need to ask the pertinent questions, you can't really ask those things online as easily as you can by having the experience of someone who's traveled or has the network of people that they are close to. Not only are we getting the latest and most up-to-date news, we are also getting, as I suggested, the offers that are better. And we're also not going to send you to the airport without being fully prepared in terms of testing and anticipation of those kinds of things. And all of the tips that we've been talking about for people's trips. So it is better to use a travel agent in this day and age. But, you know, people who didn't use an agent never really understood what it was we did. So, for example, if someone books something online for an airline ticket, just the simple airline ticket, and gets a price of $300, and they call the travel agent or their travel agent or a travel agent, and the price turns out to be $325 or $350, they just assume that they cost more through a travel agent. But what's happening is when they go back to the computer and try to recreate that fare and the day and the flight that they particularly want, the fare keeps escalating, and then the taxes come on and all those kind of things. And instead the $300 tickets, $395, and they're too embarrassed to call the travel agent and start over because they had made such a scene about getting a lower price and believing in their heart that they did. Again, we are working for consumers. We are advocates for consumers when you need that money back. I'd hate to have been on a cruise line where you didn't have someone running interference to insist that you get your cash back and got it back wholly and early rather than still waiting for some of those things. I also think that you just want to take their advice and go forward. They want to work with you and they want to include you in any plans. And travel, for example, for family reunions and things. Family reunions aren't in backyards anymore. You need a third party who's going to tell the brother-in-law whose wife plans everything that you know, if something bad happens to their parents, they're going to find time to get there. Why not go on this trip, create this memory, create this celebration for families to go together and not pass on something like that. Family's still the most important thing. And that's what we're trying to create is memories and special times for people.
All right, Kathy, speaking of family, I knew this question was going to come this morning. Joyce wants to know if you're familiar with a young man named Jason Sudeikis. Do you know him?
His little boy, yeah.
Is that your baby boy?
My baby boy, 2 wonderful baby girls, but he sent the cutest pictures over the weekend. Well, let me share that they are filming season 3 of Ted Lasso in London right now. And the children are going to a proper prep school in the UK and went to see Mary Poppins over the weekend, and video of them dancing in the streets on the way home and singing songs, Chim Chim Cheree and all that kind of thing. It was really, really cute to share that with them. And I'm dying to get on a plane and see them.
I bet.
Roy Kent.
I bet you're.
Roy Kent. He's here.
So
He's there. He's everywhere. I left out of work.
I know. So we have. I know.
The best.
So Kathy, I know you're a very proud mother, a very proud grandmother, and we're all very big Ted Lasso. We dressed up. My spouse and I, we dressed up as Ted Lasso for Halloween. So
who
yeah.
were you?
What's that?
Which one were you? Were you the
Stop
boss?
it. I was, why am
Rebecca,
I helping?
the
Oh,
owner.
Rebecca. Thank
Rebecca,
you.
okay. Well,
Of
what if you're
course.
gonna be Rebecca
I
if you're
had
gonna
my
be-
blonde wig, and I was Rebecca, and had my little
Right,
box,
isn't
my
that her
pink
name,
box
Rebecca?
with my little
Yes,
shortbread
right.
cookies and everything. So, yeah, we're very big fans. We're big fans of you, and just a pleasure to be with you. I'm going to get some final thoughts from you in just a quick moment, but a question, kind of a final thought before that is where we go from here. We're talking about 2 years today since we had our first patient, but a question from one of our viewers is, I'm really interested in knowing where we go from here.
Yeah, I think that's interesting too. I don't think we know. Okay, we do know that the 1918 influenza pandemic that really lasted about 5 years. How much longer will this last? I don't know. We have to understand and define what we mean by how long will this last. Certainly our experience here in the United States is probably much better because we have vaccines, because we have therapeutics. So that will help. Will there be more surges and variants? I think we have to assume that. I think we would be naive not to. But individually and individual bubbles and families, we can protect ourselves as much as possible so that we don't have to go back to those high hospitalization rates or have the experience of what Hong Kong is having right now, and that is get vaccinated and try to do those prevention measures. If you are going to those high-risk situations, it's okay to wear a mask if you want to. I think we have to expect other surges. I believe and I hope and I pray that it will be lower than that Delta surge, so that's certainly lower than the Omicron surge that we just saw. But we have to remember that individually now it is really up to everybody to try and protect themselves, reduce their chance of going to the hospital, and by doing that, that is being up to date with vaccination.
I think that's the exact right point, Hawk. I think here's our challenge. There are things that we can control and things that we can't. Yep. The things that we can control help the things we can't, because if we're vaccinated and we spread less disease, then we have a lower risk of developing more variants. We've got really effective therapies emerging between the monoclonal antibodies, Paxlovid, and there are other generations of antiviral drugs directed at SARS-CoV-2 coming out. That's really important because those are really game-changing moments. But the thing that we have to be afraid of is another variant that can escape those therapies, and then we are back to doing the things we've done to try and stay safe. I'm relatively optimistic. I think your point, you and I have had this discussion before, that these kind of viral epidemics historically have this 3 to 5 year cycle length, and then they kind of dissipate. And a lot of that may be host immunity through a population. It may have been that the virus then mutated into a different form. Some people have speculated that SARS is that class of coronavirus. It started out when it first started in the 1800s or whatever time frame that may have been. It may have been more deadly then, and then it became a little safer. Other people say, well, no, the viruses don't. If you listen to TWIV, they kind of downplayed the whole thing about viruses becoming safer. You listen to the New England Journal, viruses are going to get safer. So I don't think we really know, except we do know something. We do know how to protect ourselves and protect our loved ones and take care of each other. And if we can stay true to the principles of infection control, what we've always said, they keep you safe up until this moment, and they travel with you wherever you go. And if you follow those principles, you can really do a lot better job of staying safe. And so I would just remind ourselves that the principles of infectious control still travel wherever we go.
And with that, I'll let Kathy have our final thought. First of all, just thank you so much for being with us today, Kathy. Go see her. She's at Ascendus. So go see her and her team over there if you plan to do any traveling in the next coming months. Get booked up. But just thank you for the Travel 101 lesson today. I think there were just some good reminders about just how to do it right and to make your dollar go as far as it can and be smart. So just a quick final thought on what you want everyone to know as they're booking.
Well, I thank you very much for the opportunity. It was fun to learn more and to listen to the update of what we're trying to accomplish as well. We're telling people to go to their physician, get their information right, and let us put dot the I's and cross the T's for them, depending on the actual destination that they're going to. But not to be afraid of travel. It's one of those rights that we're not able to have guaranteed when you think about what's going on in the world right now. So Americans want to be back on the road. They want to be back in the air, and they want to be back at sea. Cruising has never been safer as well. So I think it's time to, as long as you know you have a worry-free opportunity to go to Plan B, that you should consider making these plans and be on your way.
Kathy, thank you so much for your advice today. We'll see you soon. Take care. All right, and thank you all so much for being with us today. Don't forget, you can catch our show anytime by logging on to Facebook, YouTube, and now on Twitter. Coming up tomorrow, the connection between childhood diabetes, kids, and COVID. New studies suggest kids who have contracted COVID are at a greater risk for developing diabetes. We bring in the experts to explain and what signs parents should look for. That's coming up Monday at 8. We know these past 2 years of this pandemic have brought a lot of changes to our lives, kind of creating this new normal that we've been talking about. The ups and downs are ones that none of us will forget. Our team of editors have looked through the hundreds of hours of videos that we have done and put together this recap of the past 2 years. We leave you on that note. So everyone, again, be safe and remember that the pandemic, it's not over. Welcome to our first virtual news conference. I'm Jessica Lovell with the University of Kansas Health System.
Our purpose of this press conference today is to answer our questions about protocols for care and for public safety.
We've learned a lot, but there's a lot more we need to learn.
Avoid putting your hands in your eyes, your nose, your mouth.
Sunny says, have your mask ready. Make sure it's comfortable. You'll wear it most of the day.
What about giving out candy? How can we do that safely?
Beds are at capacity, staffing is at capacity. This is KU, go ahead.
Nobody's more tired of it than we are, but we're still here and we're doing it every day.
I had one day where I had 3 people die before 9 a.m.
The COVID blizzard continues in Kansas City and the metro area.
Every day it's a new record, unfortunately.
We know the disease is prevalent throughout the community right now. If you have symptoms and you can't get a test, you need to go forth with an abundance of caution, and that means really to act as if you do have it.
And remember that love, at the end of the day, is still more powerful than anger.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.